community. However, as we increase testing, we'll naturally see an increase in the number of cases. So we'll continue to monitor these numbers as related to our testing and continue to update you. Earlier this week, we announced expanded testing sites. And as a reminder, anyone with symptoms who would like a test can call 211 and be connected with a testing site through one of our community health centers. The centers have seen an increase in individuals requesting testing, but they still have more capacity and more availability. So please call 211 if you believe you are having symptoms and in need of a test. In the same vein, if you're having worrisome symptoms, whether related to COVID or not, please engage the healthcare system. Delaying needed medical care can lead to worsening of medical conditions. And this includes not only potential emergencies like chest pain or stroke symptoms, but also critical vaccinations and other preventative care. What may today be a simple clinic or emergency department visit with treatment and discharge home could be a prolonged and complicated hospital stay if you delay your care. Our 911 and emergency services are available for those in need. And likewise, our hospitals are open, they're safe, and they're ready to help. Finally, we've seen a tremendous outpouring from the public in donations of personal protective equipment, totaling over 25,000 items donated. This includes critical N95 masks, procedure masks, gowns, and sanitizers for those on our front lines. That said, personal protective equipment supplies continue to be low. In particular, N95 masks and gown inventory remain particularly low. Please take a look in your basements, your storage bins, your workshops, your places of business if you own them, and consider donating this equipment. Again, it can be dropped off 7 a.m. to 7 p.m., 7 days a week at the Tommy G. Thompson Youth Center at State Fair. It's Gate 5, located off of 84th Street. And now I'll hand it off to the Director of Greenfield Health Department, Darren Rausch. Thank you and stay safe.
Thanks, everyone. I am Darren Rausch from the City of Greenfield Health Department, and it's my pleasure to join as a representative of the suburban health departments today. Specifically today, I'm delighted to share data updates from our Epidemiology Intelligence Unit. Specifically, our Epidemiology Intelligence Unit has been working with countywide COVID data for the past several weeks. And this data I'm going to share with you today is complete through Wednesday, April 28th. So the first graph I have here to show you today is the daily numbers of COVID-19 cases in Milwaukee County. You've heard us report over the last several days that there have been increases, and you certainly see that in our data. We peaked in early April, but certainly we've had a significant increase in cases over the last couple weeks. You will note reflected on this particular figure, we have identified the House of Corrections cases in a light gray color and the non-House of Corrections cases in a dark gray color to differentiate the difference between COVID spread within the House of Corrections and outside in the community. When we look at this data further smoothed over a 1 week period, we do see the same trends, but we see a little bit less of the variation that we see in data day to day. And again, it supports our peak in early April, our decrease in cases due to safer at home measures, and a little bit of a leveling with an uptick over the last several days in cases throughout Milwaukee County. Next, I'll show you the COVID growth rate table and chart. Our current doubling time in Milwaukee County is almost 17.5 days. That's the number of days it takes for COVID cases to double in our county, which is very different than the early days of the outbreak. On this particular figure, we see Milwaukee County in purple, the metro region in blue, and the state in black. And we can see that we're all leveling off a little bit. Those doubling rates are increasing, but it's a good way to track what's happened in the pandemic in the county over the last several weeks in comparison with some other areas of the state. Another way we like to look at the COVID transmission is looking at the transmission rate. And this figure you see in front of us here looks at the reproductive number or transmission rate for Milwaukee County over the last 5 weeks. And we see that we've made significant decreases in that reproductive number of COVID over the first couple weeks. had a flattening for the next week. We dipped to our lowest transmission rate of about 0.79 on April 7th, and then we've seen a slight increase to a transmission rate of 1. What this transmission rate means is for every one person infected, one additional person becomes infected. And so we certainly want to see that number below 1 to stop the spread of COVID in our community. In this report that will be shared with all reporters through Brian after this call, you see a number of slides about demographics for cases, for hospitalizations, and for deaths. One of the things we've been tracking very aggressively is race and ethnicity. And we still see that COVID is disproportionately impacting the Black or African American populations first, the white population second, and the Hispanic population third. So it's something that we continue to look at and track for disparity reasons. Next, I'll show you testing coverage graphs, and we see at the top a cumulative number of tests, both negative and positive. So we've seen increases in both over the last several weeks. And a little bit easier way to see that is to look at the data by tests per week. So you will see over the last 3 weeks, generally speaking, the number of positive tests has remained the same, but there have been some pretty wide fluctuations in the number of total tests that are done. Now, again, as we look to increase testing, and as Dr. Weston mentioned before, we're recommending that everybody with symptoms get tested. We will see these numbers of tests going up, and that'll be a good monitor that that is indeed happening in our community. Lastly, I'll show the first one of 2 spatial maps. The first one here is for the entire county, looking at the incidence of new cases of COVID between March 12th and April 27th. And we can see the darker red colors where we've had more hotspots or higher levels of incidence of COVID. And again, this map here is over 5 weeks. If we look at this next map, we will see this is what's been happening with COVID specifically in terms of new cases over the last week. And we see a few pocket areas of yellow to orange throughout the city of Milwaukee into the south side. And we see certainly a large red hotspot that's tied to the House of Corrections. So again, this report will be available to reporters if you would like it after this call. Thank you very much. One of the key things we continue to do is look at the data to track not only safer at home, but that our efforts in public health are mattering. And more importantly, that we're giving the appropriate resources to COVID-19 throughout the county. So thank you very much for your time.